Welcome to the first of a 5-part CE-certified TikToktivity on anemia in myelodysplastic syndrome from MLI, and I'm Dr. Jennifer Caudle. We'll only cover peer-reviewed, evidence-based educational material that will help guide patient treatment decision-making. Now, we all see patients with anemia, but when you can't figure out the cause, do you ever suspect MDS? Now, while MDS is a rare disease, I encounter patients with it routinely in my practice. I'm sure you do too. The earlier we refer our patients to a hematologist, the better their outcomes. So let's talk more about this. First, let's quickly review. The term MDS, or myelodysplastic syndromes, refers to a group of disorders caused by blood cells that are poorly formed or do not work properly. Low-risk myelodysplastic syndromes, also referred to as LR-MDS, encompass a diverse set of clonal disorders originating in hematopoietic stem cells. Management of MDS is most often directed at slowing the disease, easing symptoms, and preventing complications. Common treatment measures include blood transfusions for anemia and medications to boost blood cell production. PCPs play an important role in the early detection of MDS. We're often the first ones to encounter cytopenias during routine blood count evaluations or while working up symptoms such as fatigue, weakness, increased susceptibility to infections, or bleeding. We really need to be concerned about our older patients with anemia too, as they are at greater risk for potentially having MDS. Many patients with LR-MDS are asymptomatic at diagnosis. However, maintaining a high level of suspicion for MDS will lead to earlier diagnosis, rapid referral to a hematologist, and more aggressive treatment. And these interventions can prevent long-term complications. The diagnosis of MDS requires a multifaceted evaluation and specialized testing conducted by a hematologist, including peripheral blood smear analysis, bone marrow examination, cytogenetic and mutational profiling, and immunophenotyping by flow cytometry. The treatment goal of LR-MDS is to decrease the need for transfusions, as well as prevent the transformation to higher risk disease or even AML. We should always be thinking about how disease burden impacts patient quality of life. As the PCP with the established relationship with our patients, we're familiar with the needs and preferences of our patients. PCPs should remain vigilant when monitoring patients with LR-MDS for signs of disease progression to high risk, particularly the requirement for more frequent blood transfusions or complications. These signs of progression may be recognized through regular evaluations by a PCP in collaboration with a hematologist. Recognition of these features may warrant closer follow-up or early consideration of disease-modifying therapies, such as lenalidomide, luspatercept, or other options in trials, which we will discuss in a later video. We'll also talk about why a patient's mutational status or presence of ring sideroblasts is important to making treatment decisions. But the take-home message for this video is: suspect LR-MDS in elderly patients presenting with unexplained cytopenias, especially anemia, since timely referral to a hematologist is important for diagnosis and management. Also, monitor transfusion frequency in your patients with MDS, since frequent transfusions could indicate disease progression and the need for additional therapies, as well as impact patient quality of life. To get credit for this activity, don't forget to answer the questions on the link below. If you're ready to check out the other videos in the series now, you can click on that link now.
Hey fellow PCPs, I'm Dr. Singh, and this is the second of a 5-part CE-certified TikToktivity on anemia and LR-MDS from MLI. Now, if you missed the first video by Jennifer Caudle, please check it out at your earliest convenience. Now, as a PCP, you can have a major influence on the well-being and quality of life for your patients with LR-MDS. It all has to do with how you manage their anemia, okay? So let's learn more about how treatment decisions are guided by this really important point. Although LR-MDS is rare, with an annual age-adjusted incidence in the U.S. of approximately 4 out of 100,000, that equates to about 16,000 new cases per year. Approximately 1/3 of these patients will eventually progress to acute myeloid leukemia or AML. This number increases with age, with the median age of 70 for the onset of MDS. Now, despite the availability of MDS-specific treatments and an increased use of allogenic hematopoietic stem cell transplantation, the overall 5-year survival probably remains around 31%. The etiology of MDS is unknown in most cases, but people with Down syndrome, Fanconi's anemia, and neurofibromatosis are at an increased risk. Secondary causes of MDS include exposure to chemotherapy and radiotherapy, which is often associated with the worst prognosis. Now, as a PCP, it's really important that we perform testing to determine blood cell count for patients with anemia. A very low cell count should be alarming and prompt us to think, hey, we need to further work this up or consider working closely with a hematologist. Mismanaged care of anemia can further complicate the challenges of treating anemia in patients with MDS. Now, while some patients with low-risk MDS and anemia can be managed with supportive therapy alone, which may include red blood cell transfusions, the goal is really for patients to achieve transfusion independence, okay? And chronic anemia requires repeated transfusions. Now, with repeated transfusions, that carries a risk of iron overload and sensitization that leads to hemolysis and loss of venous access. This can then result in organ damage that can negatively impact the quality of life for our patients. The need for frequent transfusions may also signal worsening disease, and it's a progression from low risk to high risk, which is an indication for therapeutic intervention. Recommendations for the management of MDS are provided in guidelines prepared by specialty societies, and choosing the appropriate therapy should be done in collaboration with a hematologist. Now, the choice of treatment may also depend on factors such as serum, EPO levels, cytogenetics, and prior therapies. First-line treatment options include erythropoiesis stimulating agents, or ESAs, such as epoetin alpha. ESAs are commonly used in LR-MDS and result in about 30 to 60% response rates, but unfortunately, response is often of limited duration. Here's where therapies such as lenalidomide and luspatercept are another sort of novel options in anemia in MDS come into play, such as immune checkpoint inhibitors, drugs that restore T cells and adaptive and innate immunity, and drugs that target intracellular pathways. We'll talk more about all this, including efficacy and safety of these exciting treatments in video 4.
Hey, it's Dr. Scott Metcalfe here, and welcome to part 3 of the CE Certified TikToktivity series on anemia and MDS from MLI. If you haven't already, please check out the other videos in this series. With the emergence of novel therapeutic options like luspatercept, it is essential for PCPs to stay informed about the advancement to ensure comprehensive patient management. Remember, myelodysplastic syndromes are disorders in which stem cells do not mature into healthy blood cells. In the United States, about 16,000 new cases of MDS are reported each year, and 1/3 of these patients will eventually progress to acute myeloid leukemia, or AML. When patients present with unexplained cytopenias or concerning blood count abnormalities, the PCP should refer the patient promptly to a hematologist for further evaluation, as the hematologist will provide them with specialized testing such as bone marrow biopsy with cytogenic analysis to guide appropriate treatment recommendations. An accurate diagnosis is essential since MDS can be challenging to distinguish from other conditions with similar presentations, such as aplastic anemia or certain leukemias. Additionally, timely recognition and referral on behalf of the PCP to the hematologist allows for patients to have access to clinical trials if appropriate, or further referral to specialized centers for refractory cases of MDS. The necessary collaborative efforts between the PCP and hematologist cannot be stressed enough. However, patients with LR-MDSs can and should remain under their PCP's care. By partnering with a hematologist, the patient's overall health outcomes and management of their treatment can be significantly enhanced. While hematologists must remain up to date on guidelines and research regarding approved emerging therapies for MDS, the PCP should have a general understanding of these treatments as they continue to co-manage the patients and their comorbidities. As a PCP, we should know that targeted therapies are available for patients in MDS and that these are often based on age, genetic profiles, pre-existing comorbidities, and their response to prior treatments. A major advantage PCPs hold in the long-term, well-established relationship with their patients, and familiarity with their underlying health issues. PCPs can also educate patients about LR-MDSs, its implications, and their overall health, while hematologists can provide detailed information about the disease, the treatment options, and expected outcomes. This highlights the importance of close collaboration between PCPs and specialists based on evidence-based guidelines. PCPs should promptly communicate any new or worsening symptoms to the hematologist for timely intervention, and hematologists must keep the PCP informed about their newer treatment options. Early referral of a patient with suspected MDS is important, as are regular follow-up visits with the hematologist to assess response to therapy, disease progression, and the need for treatment modifications. Maintaining ongoing communication between the hematologist and the PCP to discuss these test results, treatment updates, and patient concerns will ensure optimal patient care. While PCPs and hematologists are the foundation of MDS care, other healthcare professionals such as nurses, transfusion specialists, pharmacists, social workers, and dietitians bring valuable expertise to enhance the patient's treatment and well-being. We just covered a lot of content, so thank you for listening, and check out the link to access the full series. Now, head over to the next video tag below for part 4. To watch now, just click the tag in my caption. Oh, and before you move on, to get credit for this activity, don't forget to answer the questions in the link below, and thanks for watching.
Welcome, colleagues, to part 4 of the CE Certified TikToktivity series from MLI. I'm Dr. Lauren Powell, and we will discuss how to appropriately evaluate the efficacy and safety of the newest game-changing therapies to optimize clinical outcomes for patients with symptomatic anemia and LR-MDS. You know, like I know, that PCPs are the quarterbacks of the clinical team. You are the experts managing comorbidities like diabetes, hypertension, and heart disease. But are you comfortable in treating those same comorbidities once a patient has been diagnosed with LR-MDS? Red blood cell transfusions may temporarily alleviate the symptoms of anemia, but will over time lead to iron overload, possible sensitization, and potentially lowering the effectiveness of subsequent therapies. While red blood cell transfusions quickly eliminate the symptoms of anemia like fatigue, weakness, shortness of breath, the effects of the transfusion wear off and symptoms can return if the underlying cause remains untreated. Early introduction of erythropoietin-stimulating agents, or ESAs, or newer emerging treatment options may impact the disease's clinical course and improve the quality of life for the affected patients. Patients who do not respond well to standard therapy should also be considered for clinical trial enrollment in collaboration with their hematologist. The NCC guidelines talk more about this in detail if you're interested in learning more about when a given patient should consider being enrolled in a trial. As PCPs, we should be familiar with a short overview of dosage and safety management of some of the approved therapies for patients with symptomatic anemia and MDS. The package insert for each drug provides more detailed information. Also, check out the resources in this video for additional readings and data at a glance. Epoetin alpha and beta, several biosimilars, and the longer-acting darbepoetin have been the mainstay of treatment for anemia in patients with LR-MDS. Potential risk of these agents include thrombotic events or transformation to AML. Medication side effects can and should be monitored and managed by the PCP as you continue to see patients in clinic for other comorbidities. It's especially important to be cognizant of the contraindications, if any, or other serious adverse events that may impact treatment decisions. For some therapies, the contraindications are minimal, such as luspatercept, which has none. Check out the downloadable resources for more information. For patients with symptomatic anemia requiring second and third line treatments, recent studies have shown that clinical benefit for patients with LR-MDS with low dose azacitidine or decitabine. Promising therapies include imetelstat. Recently published data from the EMERGE study revealed that 40% of patients on imetelstat became transfusion independent after 8 weeks, and the transfusion independence lasted for more than a year, with the most common grade 3-4 adverse events of neutropenia 68% and thrombocytopenia 62%. Thanks for joining us. I'm going to page to the next doctor to bring us over to the finish line with the last video of the series. To watch now, just click the tag in my caption. To get credit for this activity, don't forget to answer the questions on the link below.
Welcome, PCP friends, to the final video of a 5-part CE certified TikTok activity on myelodysplastic syndromes for MLI. I'm the hot doc, Dr. Contessa Metcalfe. Now, if you missed any of the other videos, make sure you click the link and watch them all. And don't forget to claim your CE at the end. I want to share strategies I use to develop long-term, individualized care plans for anemia management in my patients with low-risk MDS, while also accounting for their other comorbidities. For example, patients who were enrolled in the phase 3 Medalist trial and were refractory to treatment with ESAs were assessed for the impact that anemia had on their quality of life. Findings revealed that patients who were treated with luspatercept reported marked improvements in their daily life, owing to the reduced transfusion burden as compared to placebo. The inclusion of patient-reported outcome metrics provide a more comprehensive look at how treatment impacts the lives of patients beyond changes in hemoglobin. Another point I want to make is that patient-centered shared decision-making is especially important in managing complex chronic diseases such as MDS. Now, many clinical studies focus primarily on overall survival, but our patients with MDS are often older and they have other comorbidities and may have functional clinical outcome expectations that are vastly different from those of us, our healthcare providers. A recent European study identified factors that can influence clinical outcomes, such as the impact that certain treatments have on mobility, pain, anxiety, depression, and restrictions in daily activities. So the individualized treatment plans will incorporate these concerns, and they can even result in improved medication adherence and outcomes. The Cancer Experience Registry, which is conducted by the Cancer Support Community and the MDS Foundation, is an ongoing online research study that seeks to uncover the emotional, physical, practical, and financial impact of cancer from the patient's perspective. Recently presented results showed that effective communication between providers and patient still needs improvement. Many patients said they could not recall having received information from their providers that would have helped them make treatment decisions. We gotta do a better job. And in addition to disease and patient-related factors, social determinants of health, such as socioeconomic status, education level, and environmental factors, can significantly impact access to healthcare and delay the diagnosis and treatment of patients with anemia and MDS. Financial concerns and inadequate health insurance can create barriers to treatment adherence. So, incorporating multidisciplinary teams into clinical practice can help engage patients in conversations that uncover quality of life issues and non-medical barriers to care, with the goal of creating long-term, personalized treatment plans. Incorporating the patient's goals into the treatment plan is critical. So, thanks for watching. And if you've seen all 5 parts of this TikToktivity series, you can now collect your CE credit. And if you haven't seen all 5 parts, I've tagged MLI's education page. So, head over there to watch right now. What are you still doing here? Go watch the rest of them. You need the CE. Thanks for watching.